focusing on flexion, okay? At least the ones that we're going to go over today. We can do it a couple different ways. We can do lateral or medial glide, or we can do rotation of the tib, okay? Either one. Both of which you can relatively easy teach a patient how to do on their own, okay? So we're going to show you the medial and lateral glide. Do you guys remember this? From the last time we talked about these? Okay. Oh, and also, this is, it's kind of makes a little bit more sense when we get into upper extremity, so maybe I don't need to show you, but I'm going to anyway. So when we do get into upper extremity, a great way to figure out like how big the loop needs to be is to take and put it around your shoulders like that, and then just put your thumb. If it's about the point where your arm is almost all the way straight, not completely, but you're pretty close to being in full up. Got a slippery shirt on today. I don't want to stay. So I'm almost into full elbow extension, but not quite there. And so that's going to tell me that I'm pretty good there. It applies more to upper extremity than it does lower extremity, but I'm going to show you. Okay. So with knee flexion, it's going to be a lot like with ankle dorsiflexion, where I'm going to have you place your foot on the stool. And then I'm going to come, we're going to try a lateral glide to start off with. All right. And I'm going to wrap it around my buttock. Okay, get it nice and low. And then I'm going to get nice and low. Okay. And I'm applying a glide to the tibia itself, so I'm not going to stabilize that, right? But I am going to stabilize her femur, because I don't want to start pulling and she goes into, falls over, or she goes into a lot of varus, right? So you can hold on if you need to, or the plant, whichever one. Sure, go for it, okay? So I stabilize the patient's femur, I give a little lateral glide, and then I'm going to follow her as she goes in and out of flexion, okay? Go ahead. Into flexion, and then into extension. And we are primarily working on the flexion component, okay? By maintaining the same amount of pressure just by leaning back as she goes in and out of that flexion, okay? So again, with this, let's say a straight lateral glide isn't making a difference, it's not decreasing pain, it's not getting any increase in motion, then I can come and I can alter my glide just a little bit. And do the same thing, I ride that, now it's more of a anterolateral glide, and then she again goes through the motion, and I just follow right along. Okay, let's say the lateral glide isn't working, so then I come over here, and now I can try a medial glide instead, okay? That's the great thing about mobile with movement, so we just kind of keep moving around until the patient all of a sudden says, oh yeah, I can get a lot more movement, or it doesn't hurt as much anymore. Take them through that, a couple repetitions of, or a couple sets of 5 repetitions or so, and then immediately after we take the belt off and we say, okay, go through that motion on your own, and hopefully we've been able to change something, be it their understanding or feeling their own pain, whatever it is, and they're able to go through more motion. Okay? So that's our medial or lateral glide. The other one is tibial internal rotation. Okay? So this one's pretty simple. We have the patient still in the same spot. Then we're going to grab that tibia, and we're going to do some slight internal rotation, and then have them go through the same motion. Through that flexion, and then back into extension. And this, again, is something very simple that we can have the patient do on their own. We can say, you can do these things at home. All I want you to do is just kind of grab that lower leg and twist it in as you go in and out of that motion. Okay? So they are providing that tibial internal rotation as they go through the motion. You can have them, if they don't have a belt, you can have them just support with one leg or stabilize one, not leg, these are hands. With one hand, stabilize the femur, the other hand, come on the lateral side and do a medial glide, or vice versa. Do a lateral glide as they go in and out of flexion. So again, something pretty easy we can have our patients do. Okay?
I would say if you're doing the medial glide, make sure that you're blocking the femur